Everybody's good? Good morning, everybody. I am here today with City Council President Nick Mosby, Comptroller Bill Henry, our Health Commissioner Dr. Jaraza, HR Director Quentin Herbert, and our Police Commissioner Michael Harrison. And before we get started talking about COVID, I want to mention some of the efforts by Baltimore City to prepare for today's weather event and the storm that's going to hit our region later this afternoon. With the threat of possible tidal flooding in low-lying areas, the City Department of Transportation has been giving out sandbags to residents this morning to counteract potential flooding in those areas. Our residents who live in those areas, we know where they are, especially those in Fells Point, Harbor East, and Canton neighborhoods, are strongly advised not to walk or drive in flooded areas. I'm going to say we've all been in Baltimore for a long time. We know when we have these kind of events, which streets are going to flood, so you know which ones to avoid. You should avoid North Point Road and Kane Street. You should avoid Hillen Road and 33rd. You should drive on 83 appropriately. We should not have folks risking themselves. If you see water, don't drive through it. Remain as safe as possible, because we do not want to continue to have to rescue people out of situations that no one should be in. We are prepared as a city. I will be making sure that our emergency management team and our agencies are going to continue to work and be ready for whatever comes our way. And as a reminder, if you see falling trees and things like that, report that into 311, and we will get them addressed as quickly as possible. And for real-time updates, please visit emergency.baltimorecity.gov. Now, switching gears to COVID. As of this morning, our new daily case count is up almost 87% from 4 weeks ago, and we have a total of 56,012 confirmed cases of COVID in Baltimore City. Our positivity rate is at 3.1%, which is a 101% increase from 4 weeks ago, but that is the lowest in the state. Hospitalizations are still high, with 85% of ICU beds utilized and 87% of acute care beds utilized. It's clear that we are still very much battling this pandemic, and we thank all of our residents, businesses, and visitors who have done their part to slow the spread of COVID-19 by wearing masks indoors, making a plan to get vaccinated, and getting tested. As we continue to navigate the effects of this pandemic, all while working to restore critical in-person access to city services for Baltimoreans, the steps that we take today to slow the spread of COVID-19 and the Delta variant could not be more important. As such, yesterday my administration announced that proof of vaccination will be required of Baltimore City employees effective October 18th, 2021. All employees who are not fully vaccinated will be required to produce a weekly negative test result in order to report to work. We'll be sharing more information with our workforce and the public in the coming weeks as we get closer to that date. As a reminder, masks were already required inside city buildings to our workforce, as we have a citywide indoor mask mandate. We'll also be hosting additional vaccination clinics for our workforce and their households, so that as much as possible, we can bring vaccination opportunities directly to our employees. This is about leading by example. Protecting the health of our workforce, residents, and their loved ones is my top priority, and I'm confident that this step will complement the actions we've already taken to keep our city safe during this pandemic. I thank our city employees for continuing to provide high-quality service during these unprecedented times, and look forward to working hand-in-hand with our health department to vaccinate everyone who is not currently vaccinated. I'll now turn it over to Dr. Jaraza for a deeper look into our health data. Dr. D?
Good morning, and thank you, Mayor Scott, for your leadership during these difficult times. I'd like to begin by reviewing our data. Please keep in mind that the majority of COVID-19 cases nationally are now Delta variant cases, a mutation of the original virus that causes COVID-19, which is almost twice as transmissible. Baltimore City is averaging 87 new cases per day. As Mayor Scott mentioned, our positivity is 3.1%, an increase of 101% from 4 weeks ago. Our city's ICUs are at 85% capacity, and our acute care units are at 87% capacity. To date, 56,012 Baltimore City residents have tested positive for COVID-19, and 1,141 residents have tragically lost their lives to this disease. The health department and our clinical partners continue to provide vaccines for residents, meeting individuals and families where they are with our mobile vaccination clinics focused on areas of low vaccination coverage. Currently, 63.2% of eligible age residents, age 12 and above, have received their first or single dose of vaccine, and 55.9% of eligible residents, age 12 and above, are fully vaccinated. The health department provides weekly updates to our mobile vaccination schedule at baltimorecity.gov/BeMoreVax. Individuals without access to the internet can call 443-984-8650 to talk with a representative from our COVID call center who can provide information about where you can receive the vaccine. Likewise, if someone is having trouble leaving their home, they can register with our Vax at Home program to have vaccines brought directly to them and their caregivers, either by calling our COVID call center or registering at covax.baltimorecity.gov. The prevalence of the highly transmissible Delta variant required Baltimore City to reinstate its indoor mask mandate on August 9th. At that time, the CDC indicated Baltimore City had substantial community transmission. Currently, the CDC has indicated that Baltimore City, like most of the state, is experiencing high community transmission rates. We will continue to evaluate the data weekly as we consider when to lift the indoor mask mandate. Now that even fully vaccinated individuals who contract COVID-19 can spread the virus as easily as unvaccinated individuals, it remains vital that all residents, regardless of immunization status, continue to practice harm reduction principles to reduce our rates of community transmission. Remember to wear your mask appropriately over your nose and your mask, or over your nose and your mouth. Wash your hands. Keep your distance, and if you have any symptoms or exposure to someone with symptoms, get vaccinated, get tested, even if you're fully vaccinated. The health department provides mobile testing sites across the city, which can be found at coronavirus.baltimorecity.gov/testing. In the last few weeks, the FDA has approved additional doses to those who received a 2-dose vaccine and are moderately to severely immunocompromised. During the same time period, the Department of Health and Human Services announced plans to begin providing booster shots in the fall, subject to final FDA approval. This has led to some understandable confusion, and I want to take a moment just to clarify who should be looking for an additional dose right now. The additional dose recommendation is for people with certain medical conditions that affect their immune system so that they aren't able to build enough protection when they first get a vaccination. When this happens, getting another dose of the vaccine can sometimes help them build more protection against disease. And this appears to be the case in some immunocompromised people. That is different from a booster dose. A booster dose refers to another dose of vaccine that's given to someone who is presumed to have built enough protection after the initial vaccination, but then that protection decreased over time. As of now, the CDC recommends moderately to severely immunocompromised consider receiving an additional 3rd dose of either Pfizer or Moderna vaccine at least 28 days after the completion of the initial 2-dose mRNA COVID-19 vaccine series. At this time, there's not enough data to determine whether immunocompromised who receive the Johnson & Johnson vaccine also have an improved antibody response following an additional dose of the same vaccine. We encourage all residents who may be moderately to severely immunocompromised to speak with their healthcare provider about the need to receive an additional dose. The health department will not require a doctor's note, but will need to see proof of individuals' fully vaccinated status, either through a physical vaccine card or digital vaccine card. Visit myirmobile.com for assistance in obtaining your online vaccination records if you've lost your card or don't have a copy. You can also contact your vaccination provider to access your vaccination records. Some but not all of our mobile vaccination clinics and pharmacy locations are able to provide additional doses. I strongly encourage those individuals who are immunocompromised to call our COVAX call center at 443-984-8650 Monday through Friday from 8 a.m. to 6 p.m. or on Saturday from 9 a.m. to 1 p.m. for an up-to-date list of providers offering additional doses. Concurrently, the health department will begin providing booster shots the week of September 20th. Again, this booster dose is for individuals who had a full immune response after the initial vaccination series. Current informal recommendations advise the booster dose be given 8 months after completion of the 2-dose vaccination series. This is subject to change, and implementation of booster dose administration is subject to the FDA's authorization and the Advisory Committee Immunization Practices' final recommendation. Therefore, even when approved, not everyone will be due for a booster on September 20th. The CDC has advised initial boosters to go to those who were the first to receive the 2-dose vaccination series. This includes our healthcare workers, residents of long-term care facilities, and other older adults. Finally, this week, Baltimore City has mandated that city employees must be fully vaccinated by October 18th. Employees who are not fully vaccinated will be required to submit to weekly testing for COVID-19. I would like to thank Mayor Scott, Administrator Shorter, and other city leaders for this decisive step to protect Baltimore City's workforce from the worst of COVID-19. I would also encourage private businesses in Baltimore to take similar steps in their own workplaces to further reduce our case counts and protect lives. Thank you.
Thank you, Dr. Duraza. And I want to turn it over now to our City Council President and then our Comptroller, who have been partners in our response and fight against COVID-19. Mr. President?
Thank you, Mr. Mayor. We're here today because we know vaccines are critical to fighting particularly the Delta variant, which is 200% more transmittable than COVID-19 was originally. I ask Baltimoreans 2 questions when I'm around the city as it relates to hesitancy. Mr. Mayor, I ask them, 1, do you know someone or know of someone who has died or have been severely sick as it relates to COVID-19? The second question I ask is, do you know someone or know of someone who has died or been severely sick for taking the COVID-19 vaccination? The vaccination works, and it's critically important for Baltimoreans, particularly our workforce, to take it. I've been very involved since the beginning of the pandemic in providing a voice to underserved communities, and I will continue to be a fierce advocate for them. But we know that many of our municipal employees, those that are reflective of the communities that we talked about, are the backbone to our city operations, and they dedicate their lives and their livelihood every single day for a greater good. And this vaccine is critically important to them, to their communities, and to our city. It's important to keep us all safe. We know how important it is to not only wear masks, but we also know those who are eligible for the vaccination should be vaccinated. I've stressed to my family, friends, community, constituents, I'm vaccinated, and I ask each Baltimorean to become vaccinated. This step in the administration of requiring city workers to be vaccinated is a step in the right direction. This is also a signal to the rest of the city that the vaccine is a necessary step to ending this ugly chapter in our country's history, and yet again, putting Baltimore at the front of the line of being a leader associated with COVID-19. Again, we know vaccines work. I am vaccinated, and I stand today as president of the council, committed to partnering with the administration and monitoring the rollout of this policy to make sure our most vulnerable employees, notably those lives who live and work in underserved communities, have the support they need to access the vaccine. If the council has questions or needs to take a step in the right direction to help the administration troubleshoot the implementation of this policy, we stand committed as partners here today. I look forward again to working with the administration of identifying data points of populations of city workforces that have the highest amount of hesitancy. We understand and know that it's important for us to support those individuals and support our employees in ways to receive the vaccine, get more information about the facts over it, and to overcome any hesitancy that they or their families might have. We must stop COVID-19 from spreading and mutating, and again, the administration actions today is a step in the right direction. Next up, I would like to call on the City Comptroller.
Good morning. I'm going to try to be brief and get you all out of here before the storm hits. I want to start by thanking Dr. Duraza and the entire health department for their work in this. Because I know that while the rest of us in City Hall are sometimes thinking about other things, I know that they are 24/7 working to get us through this pandemic with minimal loss of life and health, and I do really respect that. I also want to thank Mayor Scott for his leadership on this new employee healthcare mandate. As I have been saying, an equitable approach to providing city services is necessary, and it means that we need to take all of the possible precautions that we can take. We need to protect our most vulnerable neighbors, the immunocompromised and the children under 12, from COVID-19, and changing and adapting the way we govern during this pandemic is going to be essential to winning the battle against the coronavirus. I am confident that this new vaccination or testing policy is going to help make Baltimore City a safer and healthier place. Thank you very much.
Thank you, Mr. President and Mr. Comptroller, for your partnership and for your dedication to helping the city through this pandemic. Now we'll take a few questions. I almost said Yvonne, since you were standing there. Sir?
Mayor Scott, this might be a question for the HR director as well, but do you have a broad number as of this morning how many city employees are vaccinated? Does that mirror the city? And does that number go into your decision yesterday to have this vaccine mandate?
I'll take it first and then allow Dr. D and Director Herbert both to comment. I think we have done surveys of our workforce throughout our vaccination clinics, but that, of course, is voluntary. Through this implementation, we'll get a much more reliable data count, but we believe that it does generally mirror the city when you talk about vaccination rates, and we'll be hosting at least 10 clinics for our employees and their families as we move forward. Dr. D, Director?
Thank you for the question. As Mayor Scott alluded to, right now the vaccination data that we receive is on a voluntary basis. This protocol requires that employees submit their vaccination status. So as this protocol rolls out, the city will have more complete data related to the vaccination rates of its employees.
Anybody else? Yes, sir.
Yeah, with a couple of studies out there that now suggest that if you have antibodies in your system, that they may be even better at combating the virus than getting the vaccine. Was there any thought given of testing city employees to see if they already had antibodies as kind of in lieu of getting the vaccine or being the weekly tested? And if not, why not?
I'll let Dr. D answer that question, but I'll say this. We are following the data and the science on what we know works for sure, and we know the vaccine works for sure, and we know the vaccine keeps people out of the hospital and off ventilators for sure. That's why we're following and taking this approach. Dr. D?
Yeah, so the vaccine actually helps your body produce antibodies, and when you look at natural immunity, meaning you had the disease and developed antibodies, versus immunity that's acquired following the vaccination, the thought is that the immunity acquired from vaccination may last longer. So even if you've had the disease, you should very much still get vaccinated to offer an increased level of protection. As Mayor Scott mentioned, we know that vaccination decreases your chance of severe disease, hospitalization, and death as a result of getting COVID-19. So we want to encourage everyone, regardless of whether you've had COVID or not, to get the vaccine. We also know that even if you've had COVID-19, you can still get reinfected, right? We've seen that nationally as well. So it's extremely important that you get the vaccine, regardless of having had the disease or not.
Next. Kate?
Hello.
Hello,
Good morning,
ma'am.
Mayor. So there are, I have a question about staffing and the time frame, why it'll take more than 6 weeks to implement it. There are some public health experts who say a vaccine mandate with a testing opt-out isn't much of a mandate at all. So why have the opt-out option? Controller Henry, you seem to allude to the fact that you're having trouble staffing up, and these are crucial services. So I'm wondering if you could explain why the opt-out option exactly what kind of pushback you're receiving from the unions, and what we could expect to see, what your hope is when you settle all of that. And if I could hear from the controller on this too, that would be helpful. Thanks.
Well, I think first and most importantly, we're taking a very big step, and we haven't had opposition from our labor partners throughout this. This is about getting people vaccinated, right? And I think that we have to take into account everything, all of the labor things that go into making a decision like this, things that we have to decide that we have to work with our partners in labor on. Our hope, the most important goal is to get more of our employees vaccinated so that we're not having people miss time for work or get sick and die as we have had in the city throughout this process. That's why we're going to be leading up to it. We have to work these things in. We have to make sure that the protocols and practices are in place as well as we build the system out to make sure that we are providing the opportunity for our employees as well.
Controller, I just wanted to hear, just because you had mentioned it or alluded to it at least.
So I'm actually going to quote the council president when I say, I think what we're doing right now is a good first step. And as you state, there is more we can do on that axis. Let's see what this first step gets us. If we find, as the mayor referred to, we're going to get better data about how many of our employees actually are vaccinated from doing it this way first. We may come back and find out that in the future, this is not enough to get those vaccination levels up to where they need to be. And if that's the case, then we may continue to ask the administration to pursue stronger options.
Can I just follow up on that? I'm sorry, just because I want to be clear. And this might be to the mayor as well, but you did mention this is a first step. We might do more later. You know, we'll see how it goes. And I did ask the city administrator yesterday, I was surprised that there was a medical and religious exemption allowed for the vaccination and the testing, which seems, I don't know if any other local or even if the state is allowing it for the testing as well. Is that something you may revisit later? It seems curious.
Yeah, Kate, everything will be revisited and looked at as we go throughout the process. We're constantly analyzing where we are and decisions on whether we go further, whether we stay the same. I'll make those decisions based on the data, and that's the decision that will be left up to me.
Mayor Scott, looking at today, we found out that the city schools are requiring vaccines for high school athletes, but it's only just for winter and spring athletes. Would you like to see fall sports athletes get required to get the vaccine as well? And then do you have any updates on, I know that there's a plan to bring back in-person services for city services, but does that apply to city council meetings as well?
Yeah, again, thank you. I'll start with the first thing. We know, I support the school system decision to vaccinate those young athletes who are in winter and spring sports. As a former city school athlete before, I had to have vaccines to even go to school, let alone to play sports. The difference is that fall sports have already started. Right, so after someone's already signed up, the parents have already signed all their forms and waivers for everything for them to play in their sport. It's kind of hard to go back and say, oh yeah, we forgot something. You have to do all that over again. So we know that pretty much all the athletes are going to remain the same throughout the year, right? I went from cross country to indoor track. A lot of football players went from football to indoor track. Basketball players went from cross country to basketball. We know that the athletes are going to be the same. It's about getting those young people vaccinated, and we know that will happen. And what's your second question again?
The city council meetings returning to in-person, is that part of the second wave of in-person services in October?
I think that what we have to say first and most importantly, that we have in-person services that are front-facing right now, but we have this little thing called the Delta variant that I think we all should be paying attention to, that we know that we have to understand the rise in our cases. You just heard us go through the number about how high we are now versus 4 weeks ago. As we move forward and talk about reopening the city, which will, again, as we always say, be driven by the data, we'll be talking with the council president and his team about how they want to proceed with those public meetings. But as I always say, I want to remind folks that when you're talking about Baltimore City residents, more of them have access now than when the meetings were only in person.
City Council President, do you want to weigh in on when you want to see the city council meetings coming back?
Very supportive of what the mayor just alluded to.
Emily?
You've taken this step with city employees to mandate vaccines. Would you like to see city school administrators require their employees to be vaccinated?
Well, the city school system has the same exact plan that we have today as of right now. They either have to get a vaccine or get tested weekly. So we're a lockstep on this right now.
May I have an off-topic question and that I'm sure you'd want to respond to. At the Board of Public Works meeting this morning, there was a bipartisan criticism of the climate control issue in city schools by the governor and the comptroller. Controller Francho called it unacceptable, and he said something to the effect of this goes to a civil and socioeconomic issue at this point. Can you weigh in on that?
Well, first, we know the comptroller's running for governor, and we're finally glad he's paying attention to Baltimore City. Let's start there. But we have to understand this, Kate, that 3 years ago, there were 75 schools in Baltimore City public schools that didn't have air. That number is now at 21. And the city school system had a plan that, of course, everyone knows education in Maryland is a function of the state, that was approved by that Board of Public Works that both the comptroller and the governor sit on. You heard that from the treasurer today. You heard that the IAC raves about the city schools plan. They talk about how they are on par with the plan that was approved by both the comptroller and the governor. So what I would hope that they both do is put the partisan dog whistles back in their pocket and focus on what they voted for, and that's the plan that the school system has, and also remind everybody that Baltimore City Schools, to the state's admission, are now thankful to an override of the governor's ill-cited vote, will now be rectified of being underfunded by the state of Maryland to the tune of $300 million a year. Thank you.
Mayor, the Public Safety Union seemed to think that there might be additional vaccine incentives rolled out with this policy. Is the incentive just simply not getting tested, or are you exploring other positive incentives?
Well, we're going to continue to have discussions about all options, and we have had, as I said earlier, I know some folks yesterday thought that the public safety unions were against what we're doing. That is not. We have had no negative conversations with them or any other of our labor partners, and we'll work with everyone to see how we're going to do this and make sure that we're keeping our employees safe and getting people vaccinated. Thank you, everybody.